Obviously, you were there during the first surge that we saw in New York. You've been through this Omicron surge. Where are we now?
Yeah, so if you take a look at the peak, the peak for us in the beginning was April 2020. And for our health system, we had almost 4,000 patients with COVID-19 in the hospital. How do you compare that to our last surge? It's almost a quarter of that. And those patients who got admitted, if you were admitted back in 2020, 30% of those patients wound up in the ICU. If you were admitted recently in the hospital, it's less than 10%. So very, again, same virus, variant, very different profile. Now, I hate to say it's less severe because when you get it and it's severe, it's bad. But in general, you're hospitalized less and in the ICU less.
And are the treatments better when you go to the hospital?
Well, it's interesting. We could have this discussion about being admitted with COVID or for COVID.
Mm-hmm.
It's another strange thing we're dealing with. It back in 2020, if you got admitted and COVID positive, you had COVID disease. Now it just you may have you acquired COVID, but you're not ill enough for it. So the therapies are really good now. You get remdesivir, you'll get dexamethasone, you get all these supportive therapies, and I think we're a lot better at taking care of the supportive care of these patients. And I think that's gone a long way to why our death rate is not as nearly as it was in the past.